Good morning, America. Welcome to our first TV USA. Black fungus. Yes, it is called the black fungus and it can be deadly. It is also adding to India's growing COVID-19 woes at the moment. On Sunday, the Indian Council of Medical Research, India's Health Ministry, issued an advisory calling for better awareness, screening, and management of mucormycosis, a rare but dangerous fungal infection. While exact numbers are not available, we are seeing a rise in cases in Delhi, Gujarat and Maharashtra, says Dr. Aparna Mukherjee, a scientist at the Indian Council of Medical Research and one of the experts who wrote the advisory. The symptoms of mucormycosis are mild at first and can often be missed in the initial stages. Dr. Ronak Shukla, an our nose and throat doctor assigned to COVID-19 care at the government-run LG hospital in Ahmedabad, treated a 35-year-old male patient who recently recovered from COVID-19 after being administered oxygen for a week in the intensive care unit. Several days after recovering from COVID-19, the patient was back, complaining of an intense headache, pain in the sinus area and the right eye, blurred vision and swollen cheeks. An endoscopic examination revealed discoloration, a blackened area around the nasal sinuses. The disease progresses rapidly and attacks blood vessels and live tissues. Shukla says, as it kills them, it turns them all black, and that's where gets the name black fungus. In just 3 days, it can spread to the eyes or the jawbone. In such cases, the only way to stop the spread to the brain is to remove the infected eye or jawbone surgically. Once it spreads to the brain, the fatality rate is over 50%. It is sad to think that people who have gone through the immense distress of COVID now have to deal with this severe disability as well, he says. Mucormycosis is not a new disease, Shukla says. It is caused by a group of molds called mucormycotes. Individuals are infected after inhaling fungal spores found naturally in the Indian's urban environment and soil. For most people with a healthy immune system, exposure to the fungal really won't matter, he says. They won't get sick. India's current battle with COVID-19 may be brewing many of the complications that are leading to an unprecedented rise in these cases. Doctor suggests India has reported 23 million COVID-19 infections and a death toll of more than 250,000 people, accounting for 1 in 5 active infections worldwide. Mucormycosis is an opportunistic infection. Mukherjee says before COVID, people were far more likely to contract it only if they were in a situation where their immunity was weak. Say, after an operation, a prolonged hospital stay, transplant, but today, COVID-19 has weakened immunity considerable, leaving more people vulnerable to the disease. Shukla says there are now 100 cases in public hospitals in Ahmedabad, when previously there were only 2 to 3 cases a year. People who have gotten sick with mucormycosis have had 3 factors in common, says Dr. Devasis Palkar, a psychiatric resident now treating COVID-19 patients in critical care at the government-run New Delhi Civil Hospital in Surat. 30 cases of mucormycosis have been admitted to the hospital over the past week, he says, and new cases are popping up every day. COVID-19 is the main culprit, followed by uncontrolled or newly diagnosed diabetes, and finally, the added effects of steroid, which, though the life-saving drug, can render you immunocompromised if used at higher doses than recommended or for a longer duration. We need to find a way to moderate the drugs, Palkar says, but with such virulent attacks of COVID, the patient might die without the medication. Treatment for mucormycosis involves identifying the condition in infected patient quickly, removing all infected tissues through surgery and following up with an antifungal injection called Amphotericin B, the injection costs 3,000 rupees. In India, it has to be administered every day or 21 to 42 days. States such as Mumbai are now making the injection available free at public hospitals since their cases are rising. 2. Rajesh Tope, Health Minister of Maharashtra, says the state may have over 2,000 cases of mucormycosis. Timely intervention helped save his patient, Sugla says, and he did not suffer other complications. But as the pandemic rages in India, hospital hygiene will eventually need to come into scrutiny. If the hygiene in hospital is not adequate, then the damn surfaces such as hospital devices and equipment can breed the fungal spores, exposing patients when their immunity is most compromised, Sugla says. Beyond the report, Hosak TV USA.